Okay, good morning, good afternoon, dear viewers, friends, colleagues. You here again at the Innovative Sustainability channel. And it's my pleasure to have Dr. Azam here with me, continue our discussion about the microbiome, specifically our second question, which is quite large. That's why we have second video. It's how gut microbiome affects brain. So, Dr. Azam, nice to see you. Thank you for your time. The floor is yours.
Thank you very much, Professor Marina. It's my pleasure to be with you again. As I mentioned before, I have hashtag love your microbiome. And let us take a cup of tea with Dr. Kayase in clinical microbiome science. What I mean by T is training, E education, and A awareness. This is the most important for all of us. Professor, student, human being, people, all this, they should know what is going on between the gut microbiome brain axis. Of course, there is 5 points we should discuss. As I mentioned before, the gut produce key neurotransmitter. The second one, communication happens through the vagus nerve. Gut microbiome shape neurotransmitter balance, and inflammation links the gut and mental health. And the fifth one, diet and stress directly affect neurotransmitters. You know, the first one, let us discuss the first one. The first one is the gut produce key neurotransmitter. And this is the most important. You know, serotonin, about 90 to 95% of the body of serotonin is made in the gut by microbiota. The other neurotransmitter, GABA, produced by certain gut bacteria, which reduce anxiety and promote to be calm. Dopamine, another one, about 50% of the body's dopamine is produced in the gut. You see how much the gut is really a paradise for our brain. Acetylcholine is important for memory and learning. Norepinephrine is influence the attention and stress response. That's meaning almost most of gut-made neurotransmitter don't cross the blood-brain barrier directly. They influence the brain through nerve signaling, and this is the most important. And they influence the brain through immune pathway and through the gut hormones. This is really, we should know why our gut is the second brain. If we go to the second element, communication between the gut and brain, how happen? Through vagus nerve. The vagus nerve is the main communication highly between your gut and brain. When gut cells release neurotransmitter, they activate vagus nerve fibers. They send signals directly to emotional and cognitive centers in the brain. That's meaning why gut distress can cause anxiety. That's meaning we should calming our gut and improve our mood. That's meaning our mood will be made in our tummy. Take care. Love your microbiome. The third one, gut microbiome shape neurotransmitter balance. How? Your gut microbes, bacteria, viruses, fungi, and other produce chemical. This chemical influence neurotransmitter release, regulate inflammation, affect stress hormone production, alter brain plasticity. For example, some of this bacteria, call it lactobacillus species, produce GABA. The other, bifidobacteria, assist in serotonin production. Disruption, we call it dysbiosis, the disruption in microbiome diversity are linked to anxiety, are linked to depression, are linked to cognitive decline. I have so many projects about what is the microbiome signature in anxiety, what is a microbiome signature in depression, what is a microbiome signature in cognitive disorders. Why? If we reshape this microbiome signature, that's meaning we'll be happy and we can treat all this disease. What you call this treatment? Microbiome-based therapeutic tools. If we go to the fourth one, everybody say I have brain fog. Why? Because the inflammation links between the gut and mental health. When the gut barrier is compromised, sometimes called leaky gut, but I don't like this one. Inflammatory molecules can enter the bloodstream and can affect the brain badly. They can lead to increased anxiety. They can lead to depressive symptoms. They can lead to brain fog because a lot of patients say, "Oh, come and say, I have brain fog. I don't know what is going on." That's meaning we should check your gut. The other parameter is reduce resilience to stress. That means this is the most important. If you want to de-stress, you should take care of your gut microbiome. The chronic inflammation is the most important contributor to several mood disorders. That's meaning take care, please, of your gut, love your microbiome. And the last one is diet and stress directly affect neurotransmitters. For example, poor diet harms beneficial gut bacteria, decrease neurotransmitter production. Chronic stress, you see, chronic stress. How chronic stress affect our gut? It changes the gut motility. It changes the pH. This is make a shift in microbiome to a neurotransmitter become imbalance. That means imbalance microbiome signature. It will induce imbalance in neurotransmitter. For this, please take care of your gut. This explains why dietary changes or stress reduction often noticeably improve your mental well-being. And really, in the end of this part, love your microbiome to be happy, healthy, and wealthy, longevity, successful life. Thank you.
Thank you so much. It's so many insights, especially on the aspect of anxiety and depression. This is such a big thing. And normally people will approach it either by denial and then by asking help.
Right.
Some of them go to psychologists, some of them using, of course, medicine.
A lot of medicine.
A lot of medicine, and of course it has side effects for obvious reasons. So, of course, traditional way may be great and continued, but at the same time, you can self-help, like you're describing, that would be amazing, a breakthrough, and more sustainable in terms of less use, less cost, I imagine, and more towards, reshape the body so that it responds to the stress. And many of us can relate, myself too, constant stress is something that, last thing you think is will help with the gut microbiome, but it's amazing to how many things one can learn just listening to that. Thank you so much. I imagine listeners will enjoy, and we'll stop here.
Thank you.
Take care.
Thank you. Bye-bye. Bye-bye. Bye-bye.